Hello everyone, welcome to Sharmit. In this session, we are going to talk about another very important topic related to medical coding anatomy, and mainly we are going to talk about the lateral anatomical term of direction. If you remember, in our last session we had talked about other important terms that comes under anatomical terms of direction like anterior, posterior, right, superior, and likewise. So this session is in the continuation of the same, where we will be learning about lateral anatomical term of direction. I'll provide you some sort of notes that you can refer for your interviews and exam preparation. Firstly, we will understand what is lateral, we will see the definition, then we will see some clinical example, medical coding related examples, and also I will provide you one trick through which you can remember all these things together. Additionally, I'll also share some pointers that will help you to answer the questions of your interviews during your interview or examination. So in every session, like, there is one question also, so that you can also refer. But before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic. Because for time being, we are just mainly focusing on lateral anatomical term of direction. But prior to that, you should know about all those terms that we have already covered. And for that, you can refer the Sharmit digital course book, which is freely available in the description box, where you will find thousands of sessions. There is a particular tab for medical coding where you will find all the resources related to medical coding available in both Hindi as well as English language. So according to your language preference, you can easily consume the content from there. And in case if you want to ask any questions on it, you can simply reach out to me through comment section. Okay. Alright, so let's get started with the definition itself. So definition is very simple and straightforward, that lateral means away from the midline of the body or toward the sides of the body. Okay. So lateral means it is away. So if we are considering an imaginary vertical line, so it is away from that line, or you can say toward the side of the body. So in simple word, you can say any structure or a body part that is farther from the imaginary vertical center of line is called as lateral. Fine. So lateral means away from the midline toward the side of the body. Now, what is midline? So if you don't remember, let me quickly recap it for you. So midline means the midline is nothing but an imaginary vertical line that runs from the top of the head to the feet, dividing the body into left half and right half. Okay. So any structure closer to this line is medial. Any structure farther from the line is lateral. So these are the two terms that you have to remember. Medial means toward closer to the line, and lateral means away or farther from the line. Okay. So you can think of the midline as a center line on a road. Structures on the lateral side are closer to the edge of the road, away from the center. So these are the things that you can remember for lateral and midline difference. Now I'll show you the opposite term. So opposite is same, like the direct opposite term of lateral is medial. And we just discussed that lateral means away from the midline toward the sides, and medial means toward the midline toward the center. So these two terms always work as a pair. You cannot understand one without knowing the other one. Okay, and these are the simple examples, like the ears are lateral to the eyes, the nose is medial to the eyes. Now to see more example, you can refer these notes. Here I have noted down the sentence along with their meaning. So the ears are lateral to the eyes means the ear are farther from the midline from the eyes. The lungs are lateral to the heart means the lungs are farther from the midline than the heart. The radius is lateral to the ulna means the radius farther from the midline to the ulna. So these are the some you can say comparison example where you can understand how to use it in a sentences when utilizing the lateral. Okay, now let's see how the combined directional terms are prepared with this term lateral. So lateral can be combined with other directional terms to be more specific about location, like superolateral, which means toward the upper part from the midline, inferolateral toward the lower part and away from the midline, Anterolateral means toward the front and away from the midline. Posterolateral, that means toward the back and away from the midline. So these are the some combined term with their meaning. So this is how it is utilized. Now if we talk about the clinical example, so you can see some examples are there, like a superior lateral breast mass means a lump in the upper outer part of the breast. This is the most common location for the breast cancer. Inferior lateral wall MI means a heart attack affecting the lower outer wall of the heart. Anterior lateral thigh flap is surgical flap taken away from the front outer of the part of the thigh. So this is called an anterior lateral thigh flap. Okay. The last one is posterior lateral disc herniation means a disc is bulging toward the back and outer side of the spinal canal. This is the most common direction of the disc herniation. So this is how like you will utilize, or you will find all these terms maybe in a combined term form or in a clinical example form. Okay, so in that area, like when you saw these kind of notes, so you should know about the meaning, like what is the meaning of lateral, what is the meaning of anterior, posterior, right? So if you already know about these terms, then it would be much more easy for you. Why? Because in that case you can easily identify the actual meaning of the terminology. Maybe like if you are using it for medical coding, so you can easily remember it from there. Okay, so let's see some example for medical coding also. So in medical coding ICT terms CMCPT, the word lateral appears very frequently. So lateral collateral ligament LCA tear means a tear of the ligament on the outer side of the knee. Lateral meniscus tear means tear of the outer cartilage pad of the knee. Lateral epicondylitis means inflammation of the outer elbow, also called as tennis elbow. Lateral Malleolus fracture means fracture of the outer ankle bone, that is fibula. Okay, so these are the all examples for medical coding related terms. Although there are so many other examples, these are not the enough one, but yeah, at least you have idea to identify the term meaning by looking at this kind of directional term. Okay, now we have learned about so many terms, direction, right? So how to remember all these things? So here I will provide you one trick, short trick through which you can remember it. Okay, so memory tip is L for lateral, which is L for the side letters on the page toward the side or edges. So just imagine there is a central line of a road in the midline, where lateral moving toward the edge of the road away from the center and medial moving toward the center of the road. Okay, now to remember it in other way, you can also learn this, that lateral, the structure you would see on the sides when looking at the body from the front. Okay, so lateral means side, medial means middle. So lateral contains the word later. So this is also a kind of trick, that think of it as a structure that are farther away, like something you will deal later on the side. Okay, because it is farther away from that line, so we are going to see it later, right? Firstly we will see the center structure, and this is how like you can identify, okay, lateral means later. Okay, later means we will look later, which is at the side of the body or side structure of the body. So these are just a trick. Maybe for some people it will work, for some there might be different trick, or even if you are learning it with some trick, just share it in comment so that others can also learn or refer your tricks as well. Clear? Because we all are here to help each other, so that's the main motive of us. Okay, so now I think this part is clear. Now as usual I'm going to share you one question, and today's question is, what is the full form of MCL tear? What is the full form of MCL tear? I'm sure you already know about this answer, so please do share the full form directly in the comment section so that others can take a reference from your expertise, because when you share your answer, it will help others as well. Okay, they don't need to look back to find out the meaning. They can directly, even they don't need to search it on a Google, they can directly read it from your comment section. Also, your answers indicate me that you are learning from these series, and accordingly like I will publish more and more sessions to this series. So if you are really learning from it, and if you are finding this session helpful, please do share your knowledge so that I can carry forward this content creation for medical playlist. Clear? And in case if you don't know the answer, you can refer the previous session. There I have explained this thing in very detailed manner. So from there you can learn and then you can share your knowledge. Clear? So yeah, that's all for today. See you in the next session with new topics. So thank you for watching Tech Sharmit.